Now with Dr. Darien, taking a look at a new study when it comes to vision loss. And in this study, high cholesterol was added to a list of 14 dementia risk factors. Please explain this one.
So this is an interesting study as we try to better understand what are our risk factors for dementia. There are certain risk factors you can't control. We're talking about genetics and age, but up to 40 to 50% of all dementia diagnoses are associated with preventable risk factors. So in this study, they looked at one of the most common causes or leading risk factors that lead to dementia, one of them being hearing loss. We've discussed it before, an importance of checking your hearing, but two other additional variables that we didn't think were associated or didn't know or have the data, one of them being LDL cholesterol. And we talk about cholesterol all the time. The thought process here is that cholesterol can build up in your arteries, that can decrease blood flow to your brain. The second leading factor, vision loss. And it's probably similar reasons as to why hearing loss is when you are less interactive with your environment, that takes stress out on your brain and that increases your risk. And so making sure that if you're finding that you're having a lot of trouble seeing at night, a lot of headaches, if you're feeling like you're constantly having to squint, make sure you get your vision checked, because as we age, that unfortunately is a factor that we need to make sure that we handle, and you might need glasses.
Well, that's one of those things, like, you know, as you get older, not that any of us are old,
not at
but
all.
like you just expect your vision's not going to be as good, that your cholesterol might get a little higher.
And you expect that the TV's going to get a little louder. I think we normalize all of these experiences. If you're walking into your home and you're seeing your older relative and the TV is loud as ever and they're asking you to repeat things, it's really important to sit down and have one of those personal conversations. Hey, let's go get your hearing checked. Let's go get your vision checked. I know that might seem disrespectful, but it's an important conversation to reduce risk. DeMarco, we'll go get your hearing checked.
I'm going to call you today.
I know you are.
I'm going to learn more about this.
I already see we're going to be in the doctor's office about 4 p.m. today.
You know it.